Hello everybody. In today's class, let us try to learn about oxazolidiones. Oxazolidiones or oxazolidiones. Oxazolidiones are a group of antimicrobial agents which are very important in the hospitals. These oxazolidiones are particularly used for MRSA, they are used for VRSA, and they are also used for VRE. So among these oxazolidiones, Lenezolid. Lenezolid is very important antimicrobial agent. It is synthetic antimicrobial agent which is very commonly used in present days in the hospital. So let us try to understand about Lenezolid, pharmacology, its clinical significance and important points, and the major points which are required for the analysis of cases and for prescription auditing. So for clinical pharmacist to understand about the cases, Lenezolid pharmacology is very important. So let's begin the session. Let's understand about Lenezolid. Before understanding about Lenezolid, let us check some important points about the class of oxazolidiones. Oxazolidiones has certain examples of drugs. In that, Lenezolid is one drug which is very important. Sutezolid, eperizolid, cantezolid, posizolid, tedizolid, delpazolid, and radizolid. So these are the examples of oxazolidiones. In this, linezolid is very important because linezolid is used in present scenario. Along with linezolid, tedizolid is also used. Remaining other drugs are under they are under investigation and they are under development. Anyways, we'll see about these drugs briefly. Let's talk about Lenezolid. Lenezolid was the first oxazolidione which is developed, and it is initially introduced in 1990. Lenezolid was the first synthetic oxazolidione. It is introduced in 1990 and it is approved in 2000. And since its approval, it is very commonly used in different conditions in the hospital. Whereas Sutezolid, it is currently under development. This Sutezolid is studied particularly for drug resistance TB. So for TB drug resistance, Sutezolid is very commonly studied. And next drug is eperizolid. Eperizolid is another drug which is under development. And cantezolid is approved in 2021. This was approved recently in 2021. It is approved in 2021. And remember one important point about cantezolid. This drug is approved by China government, and this drug is studied particularly for diabetic foot. For diabetic foot ulcer conditions, this drug is approved by China government and it is also developed by China government, and this drug is approved in 2021. This is commonly used for soft tissue infections, dermal infections, particularly in diabetic foot related conditions. And next one is posizolid. Posizolid is another drug which is under investigation. I think this drug has a lot more to study. And next is tedizolid. Tedizolid is also commonly used like linezolid. Tedizolid is approved in 2014. So in 2014, after approval of linezolid, tedizolid is also studied. And when we compare about the linezolid and tedizolid, tedizolid has very effective actions than linezolid. So linezolid is also tedizolid is also very effectively used. Next is dalpazolid. Dalpazolid is under investigation. And finally, radizolid. Radizolid is also under investigation. It is extensively studied for bacterial acne. This drug is extensively studied for bacterial acne, and if radizolid is approved, it will be useful for tissue infections, soft tissue infections, particularly for bacterial acne disorders. Now let us see the chemical structure, and let us understand the structure of linezolid particularly, because our class in this lecture we will discuss only about linezolid. So to understand linezolid, see, just imagine this is a structure of this is the structure of oxazolidone. Oxazolidone. This is structure of oxazolidone. If we see the numbering, this is number 1, 2, 3, 4, and 5. In the oxazolidone, on the first position, oxygen is there, and second position, another oxygen is there. So on the second position, due to the presence of oxygen, it is called 2-oxazolidone. 2-oxazolidone. Anyways, see in oxazolidone, if on the fifth position, if acetamide is added, and on the third position, if phenyl group is added, that compound is called lenezolid. And if we compare about lenezolid in tedizolid on the fifth position, we have hydroxymethyl group, and on the third position another phenyl group is present. So this is the difference between linezolid and tedizolid. Anyways, study about these chemical structures and all is not necessary for us. Now let us go in detail about linezolid. As I was explaining you, linezolid was first approved in 2000, and since its approval it is useful for various disease conditions, especially for MRSA, it is used for VRSA, it is used for uh, VRE, and also it is used for listeria. So these are different disease conditions in which linezolid is used. And yeah, linezolid has various drug interactions, it has some adverse effects, and its mechanism of action is very unique. So we will try to discuss all those mechanisms and related concepts. Now you see, linezolid is available in oral suspension form, it is available in tablet form, it is also available in parenteral suspension form, parenteral form. So these are different formulations. In oral tablets, it is available as tablet form. Yes, as I was explaining you, linezolid is very active against gram-positive bacteria, particularly staphylococci, streptococci, enterococci, gram-positive anaerobic cocci, gram-positive rods. It is also effective for Corynebacteria, Nocardia, and also monocytogenes. It is a bacteriostatic, but particularly for streptococci, it is having bactericidal activity. And one more important point is it is also effective for TB bacteria, Mycobacterium tuberculosis. It is also effective. Now let us try to understand the mechanism of action. Mechanism of action is very unique for linezolid. See, we already know that every cell or every organism requires protein synthesis for its survival. So in protein synthesis, initially, if we think this is a DNA undergoes transcription and forms RNA. RNA undergoes translation and forms proteins, and these proteins are required for the survival of the cell or bacteria. So in bacteria, these two steps are required in not only in bacteria, in all other organisms. So in translation, we have three stages of protein synthesis. In that, the first stage is initiation, and second stage is elongation, and third stage is termination. So in initiation phase, linezolid acts in the initiation phase. Actually, in initiation phase, what occurs is we have 50s ribosome and 30s ribosome. 30s ribosome and 50s ribosome. These both 30s ribosome and 50s ribosome combines to form 70s initiation complex. So this 70s initiation complex again further goes to elongation phase, and it produces amino acid chains. And after producing amino acid chains, finally termination stage, the termination of codon occurs and it stops the translation. So these three stages are the common stages which is occurred in the formation of amino acid chains. So linezolid goes and inhibits at 50s ribosomal site. Actually in 50s we have 23s RNA. So on 23s RNA it binds and it stops the combination of 30s subunit and 50s subunit, and by that it will reduce the production, or it will stop the activation or association of 70s initiation complex. As 70s initiation complex is not formed, elongation and termination are not seen, and further it will stop production of protein. So linezolid is considered as protein synthesis inhibitor. So along with linezolid, we have other drugs which will have protein synthesis inhibitors. We have macrolide antibiotics like azithromycin, erythromycin, clarithromycin, and along with macrolides, we have tetracyclines like doxycycline. We have aminoglycosides. All these drugs are having same protein synthesis inhibitory activity, but all these drugs will act in elongation phase. But linezolid is the only drug which will act in initiation phase. That's why it is very unique. Okay, so I think you understood the mechanism of action. As I was explaining, yes, linezolid inhibits protein synthesis by stopping the formation of ribosome complex, 70s ribosomal initiation complex. If you see the pharmacokinetics of linezolid, Lenezolid is available in oral form as formulations we have seen. It is also available IV infusion. So when both oral form and IV form is given, 100% bioavailability is seen in both IV and oral. Yes, oral administration and IV administration has 100% bioavailability. So always prefer oral form tablets, as IV infusions are always they are expensive. So it is 100% bioavailable from the site of administration through oral route or IV route. It is distributed to all parts of the body, particularly to the cerebrospinal fluid also. It is distributed in cerebrospinal fluid, and it is metabolized in the liver. And in the liver, the linezolid is metabolized into two inactive form. Okay, two inactive form, and the inactive form is excreted through urine. So this is about pharmacokinetics. And yes, linezolid has no metabolizing enzyme inducing activity or enzyme inhibitory activity, that you need to remember, because some drugs like phenytoin, we have enzyme excitation property, I mean enzyme inducing property. So cytochrome P450 enzymes are induced due to phenytoin, but linezolid has no action on induction of enzymes or inhibition of enzymes. Yes, 100% bioavailability, we have seen this. Metabolism, it is metabolized by oxidation, and cerebrospinal fluid concentrations are maintained properly. And yes, oral 600 mg tablets are available, and in IV also 600 mg is suggested. In clinical uses, if we see, it is very effective for vancomycin resistant facial infections. It is effective for pneumonia, health associated pneumonia, community acquired pneumonia. It is also very effective for complicated and uncomplicated soft tissue infections, very important point. And it is important for susceptible gram positive bacteria, as we have seen. And off-label uses are also there. It is useful for multidrug-resistant TB and also for Nocardia infections. And in adverse effects, if you see, we have three adverse effects. One is GI associated adverse effects. In that, nausea, vomiting, diarrhea, headache are common. And in hematological adverse effects, it causes pancytopenia, because it shows bone marrow suppression. Neutropenia can be seen, and anemia can be seen, and also thrombocytopenia can be seen. Particularly, if this all the cells are decreased, it will cause pancytopenia due to bone marrow suppression. This is hematological adverse effect. And some neurological adverse effects are also seen. It causes optic neuritis and also peripheral neuropathy due to long-term use of linezolid. And in drug interactions, one important point we have to remember, as linezolid is MAO inhibitor, when linezolid is given along with SSRIs, selective serotonin reuptake inhibitors, when it is given along with SSRIs, it will induce serotonin syndrome, very important condition. So mainly when linezolid is given, avoid SSRIs, or when SSRIs are given, avoid linezolid. And if both the drugs are given, always maintain patient's hypertension. Okay, so because it may cause serotonin syndrome. In serotonin syndrome, patient will have excessive hypertension, blood pressure increases, and it may be lethal sometimes. So that's it for today. This is all about linezolid. Thank you for watching. If you like our video, please don't forget to subscribe and share to your friends, and please do comment. Thank you for watching.